Hello, my name's Mariah Woldridge, and today I'm going to be talking to you about about Chapter 5, the emerging self and socialization in the early years. As counselors, you'll be expected to know yourself, your triggers, your biases, your values and thoughts. It's only ethical that we understand these things about ourselves so we're better able to help our clients. But we'll also be expected to understand our client's sense of self. So that's why it's very important to understand where the self comes from, where it starts, and what can impact the sense of self, right? So to that end, we'll just continue. So we have what's called the self system. The self system is the words that we use for kind of our sense of self because self by itself is too limiting. And we'll kind of get into why. Like William James distinguished self as subject, I, and the sense of self as object or self concept, me. And I is continuously experienced distinct from others. Me is a collection of personal attributes. This is kind of true as we look at a different culture's view of ourselves. Is self stable? You might often hear that, your sense of self is stable. You kind of are who you are. However, that's especially true as brain development slows down around age 25. However, for those of you over age 25, are you the same person that you were then? Are you, even if you're not that age, are you still the same person you were 5 years ago? So self may change throughout time. And I is kind of how our self is experienced in the moment. And me is a collection of these personal attributes, how others kind of see ourselves and how we kind of see ourselves as like, I'm smart, I'm funny. And I is just like our current experience in the now. I is the knower, and it's a subjective self awareness. Me is the part that is known. If you think about it, self esteem does not exist in a vacuum, it is influenced by social interaction. So self esteem is an evaluation of how of one's attributes as if we compare the way other people see us. James Cooley added a developmental perspective to this. Cooley's process happens through 3 steps about self-representation. These 3 steps are imagining how we appear to others, interpretation of the other person's evaluation of us, and then an emotional response. Now, I wanted you to know that these 3 steps are not necessarily in order. Sometimes they're out of order or in any order, but these 3 steps have kind of been hypothesized to happen, and you can kind of see why. Let's think about how some people might find interruption in that process, though. Someone with autism might not go through all the steps in this process. They might have learned how to do this process differently, as social interaction is not as easy for them. Although this is certainly not true for everybody who has autism. Someone with social anxiety might have a disproportionate emotional response or assign a more critical evaluation to themselves than what is actually being experienced by the other person that they're interacting with. It also might be similar with trauma, as the textbook examples touch on with the 2 children. The text also emphasizes how patterns or pathways are formed in this process in childhood that may linger in a person's life. So, how early does this process happen or begin? Possibly quite early. Because babies have likely a sense of self. Babies, very small ones, imitate others, which indicates that there's some concept of similarity to the people that they're interacting with. So they understand that that's a person interacting with me and I'm interacting with them. So that might make me a person, although that self-awareness does not necessarily come around as early as we like. The real self-recognition happens around 15 months, and people start using self-descriptive words at 2 years, which is very cool. But babies aren't born knowing themselves. Like, their name is elusive to them. They're not born knowing their names, but they do have a pre-self. The baby then progresses to like an I self. At 18 months, they recognize themselves and changes in themselves. Individualist culture babies typically pass the mirror test. The book talks quite a bit about the mirror test. Does a baby recognize that their appearance is altered, or is it something on the mirror that is altered? And babies from collectivist cultures will typically pass the body as object test, which means that they need to, earlier than babies from Western cultures, which means that they need to be able to move their body in order to overcome an obstacle, such as movement. This indicates how much a baby has learned about expectations from their culture at that point. And this is like, again, when babies are very small, they can kind of start to understand this. Children will also believe any statement from adults as they begin to develop self-recognition. So trauma appears to impede self-awareness, because if a child is being told negative things about themselves and they internalize that, that's not going to be good for their sense of self. Can you consider more issues about why that would be? Then we'll move on to self-control and self-regulation. Self-regulation is a pretty critical piece of development. If you work with children or even adults, you will notice that the lack of self-regulation is a common problem to have. People who have more trouble with this might have more trauma in their background, but we also might see this as impulsivity in diagnoses like ADHD. And in ADHD and anxiety, autism, and other disorders, emotional regulation might be difficult due to like things like overstimulation, where there's too much sensory input for that person's brain to process successfully. Plus, as a child ages, we see more emotion emerge, which will influence the behavior of the child. So babies don't really experience shame. It would be very awkward if they did, as you try to change a baby's diaper who is feeling shame, right? But they start to develop things like shame and guilt and pride and like senses of themselves and their emotions and responsibilities as they get older. So that kind of time will be when that process that Cooley talks about will show up even more, around age 2. In addition to that, infants, there's early socialization, parenting, and the development of the self system. As infants become toddlers, parents face new challenges. There's an interesting table in your book around it's 182 for me, but it might be different for you, that discusses important tasks that parents must undertake for healthy development of their child. Some of them should seem obvious to you. Babies need a safe place to be, right? However, if babies do not have a safe place to be, they will not have the language or cognitive capacity to remember that they do not have a safe place, that they did not have a safe place when they were very small, even if it changes over time before they develop that language capacity. But because the baby experienced that lack of safety, that lack of a safe place to be at a very early age, it can impair a sense of self as well as cause other issues as they continue to grow throughout their life. There's also a task about providing social contacts. Consider then what this COVID pandemic that people have been through might do for toddlers who were toddlers during that time without any social contacts. We might see repercussions of that lack of contact as children age, and we might even see it much further down the road. So then we need to go on to talk about parenting style. So there's warmth or parental responsiveness. This is acceptance, involved in interest, supportive. Parents who are warm are very engaged with their child and their child's wants and needs. Control or parental demandingness is setting and enforcing standards, making maturity demands, and providing structure and routine to a child, which is not a bad thing, by the way. So there's a blend of 4 parenting styles that use that warmth and demandingness. There's the authoritative style, which is high warmth along with high demandingness. Authoritarian, low warmth, high demandingness. Permissive, high or moderate warmth but low demandingness. And neglecting or uninvolved style is low on both dimensions. You might have heard of these parenting styles in your undergrad class, but we know a little bit about how parenting style influences children. If you have authoritative style, your child will be better adaptable, he'll have more social relations, higher competence, higher self-esteem, and lower aggressiveness. If you have an authoritarian style, your child is more likely to be irritable, more likely to be anxious, more likely to be angry, and not as socially skillful. If you have a permissive style, your child will be more uncontrolled and impulsive and not be able to rely on themselves, but they'll have pretty decent self-esteem. And if you have a neglected or uninvolved style, you'll see more impulsiveness, more aggression, more depression, more low self-esteem. And there aren't really a whole lot of positives to this neglecting and uninvolved style. The book has a lengthy explanation of more behaviors that parents engage in that play into these things, but we need you to know that outcomes are influenced by many other factors. So it's not just parenting style that strictly tells the children how they're going to be throughout their entire life. As the book makes sure to note, an authoritative parent might be warm and a good level of demanding for their child with high expectations because they know that the child can handle it. So it very much might be the child's temperament. Or it could be genetics. Parents who are calm and warm might have calm and warm children. It also could be much further than that. But parenting, there's it does impact the child, but there are other factors that are also present as well. Parenting practices, so methods of control. We kind of talked about demandingness. This is how parents get through to their children. There's power assertion. So there's physical punishment or threats or withdrawal of privileges. This is kind of what we see we see a lot of this as a discipline for children. And there's differences between mild and severe. Mild will very, very likely get you the behavior that you want. This is things that are very low touch, low harm to the child, like timeout. And the book has a very lengthy thing about timeout corners in it, and that I highly recommend that you read. And that's pretty mild. It's going to get the behavior that you want out of the child in the short term, not necessarily the long term. And it doesn't cause any lasting harm to the child. And then you get to the more severe threats and things like that, which only serve to increase anxiety and aggression in a child. And the book goes extensively about things like that. And we'll get to more of that here in a few minutes. But again, power assertion techniques are effective for immediate control, but longer term, harsh forms just increase the aggression in the child, and the child will take that out on others. Then there's love withdrawal, withdrawing attention or affection or expressing disappointment. Again, this kind of works in the short term, but the child will be more likely to be anxious. But there's not a whole lot of, unless it happens very, very consistently, there's going to be not many effects on long-term self-regulation. It doesn't really work, and it makes the child a lot more anxious if you withdraw your love from them. And we kind of think that might be obvious, but some parents may have been parented that way, it might be modeled that way, or it might be just likely to happen based on the parent's interaction with the child. Then there's induction. This is explaining and appealing to a child's desire to be grown up. This is the most effective for the child internalizing what their experiences are, and is better at allowing the child to self-regulate long term. It'll be better off for the child over a longer period of time, and they'll likely be more functional because of it, and more successful in things like school. Then there's moderators of parenting and parenting effectiveness. Other possible explanations for the correlation of parenting style with child outcomes. So there's plenty of things that can influence a child's outcomes. Again, beyond parenting. The shared inheritance of traits may influence parenting style, like I mentioned just a few minutes ago. The child's temperament influences parenting. If a child is just very difficult and positive parenting isn't likely to work, a parent might become frustrated and start using those kinds of power and control types of parenting just because they're exasperated. It's often not what we want to see happen, but it will sometimes happen because nobody is perfect. There's also cultural context to parenting effectiveness. There's a parenting value chart in your book on page 191, and it kind of talks about traditional value orientations of different cultures, traditionally important values to these certain cultures, and the effects on parenting. So culture absolutely shapes parenting practices and effectiveness. But it's important not to conflate culture with geography, socioeconomic status, or race, because we don't want to risk stereotyping different cultures and assuming that all cultures behave in the same way, or that cultures have certain cultures are more likely to have negative outcomes on their children. That's not exactly true. So there's wide variation between, like, within and between groups. All groups will have parents who are not good for their children, and all groups will have parents that are very excellent for their children. And those are not necessarily race or socioeconomic decisions, although they might be influenced by their culture, of course. Then we'll look at conscious, the beginning of a moral self. As parents, discipline will trigger anxious arousal in a child. There should be a balance between eliciting anxious arousal in the child and not making the child fearful of their parent. Because intense anxiety during discipline may cause a child to focus on their own feelings and not the message that is needed to change their behavior. So parenting, if the child is fearful, they will have a negative impact on their self-esteem, behavioral self-regulation, and won't necessarily learn the rules. They'll just be afraid and compliant only because they are afraid. So internalization is associated with consciousness or conscience. Feelings of distress when one violates a rule or contemplates violating a rule is something that we kind of want to see in children because it will prevent them from breaking rules. And two aspects of parenting promote these processes: a warmth and responsiveness to facilitate self-control, and then anxious arousal facilitates willingness to comply and internalization of standards. So we do want a little bit of anxious arousal there, but we don't want to take away the warmth. Committed compliance is a willingness to go along with parental requests. And the higher this is by age 2, the more likely a child will have a strong conscience later. And harsh discipline in toddlers is not as helpful with this. Again, referencing the books talking about that timeout piece and other kinds of disciplinary actions. There's quite a bit in there about those. And then applications, building a sense of self through attachment relationship. So Crittenden formulation provides a model for counselors to understand how individuals build self through attachment relationships. And again, you might have heard these in undergrad, but we're going to talk about them again. There's securely attached, insecure avoidant, insecure anxious, and securely attached infants are reinforced for expressing positive and negative feelings. Encodes that they're a valuable and loved person, because all of our feelings, especially at that age, are pretty valid. Children will act out because they're experiencing something specific, and if an adult around them can identify what that is, the child will be much better off. Then there's insecure avoidant infants. Learn that displays of distress elicit rejection, punishment, or withdrawal. They don't necessarily get to develop a full emotional self, and they get to be very constricted. This would be like the child described in the book. Because if a child cries, then they might be punished for crying instead of accepted, and the parent trying to figure out what's wrong. And then there's insecure anxious infants. Learn that displays of distress elicit unpredictable results. It might result in a parent either like hugging the child or pushing the child away because they don't want to deal with that child. And they'll the child will then be emotionally volatile as a result. And then applications. Why train parents? So there's things that you as future therapists will be able to do. Parent training or parent management training is very effective for children, and it's where you as a therapist interact with the parent. Yes, the child is the one having the behavior issues, but you'll interact with the parent predominantly, and you may not interact with the child at all. They're not usually involved. Parents will use more observation and self-awareness and make notes of interactions with their own child. And this is effective in reducing noncompliance and promoting pro-social behavior. It can strengthen limit setting side of authoritativeness and improve quality of life in the home, reduce stress for everybody in the home. And the book makes sure to note that in cases of ADHD, having medication and treatment, behavioral treatment in this case, including parent management, is much more effective, as ADHD is a neurodevelopmental disorder, and it's a difference in the way the brain functions, which we'll get a little bit more into the next chapter and probably later in your studies as well. But certain children may need more support than just parent training. Parent training also parents will practice the parent training during the sessions and then try it at home, and then they'll bring back and work through what worked, what didn't with you, the therapist. Therapists also use motivational interviewing, which you might have heard or you might hear in context of substance use, but it's basically to elicit buy-in to this method, basically. And parents will put this idea to the test at home. There's also a very similar treatment called PCIT, or parent-child interaction therapy, that you can get certified in as a therapist. And it's the therapist will watch the parent interact with a child from a different room, usually through a camera. And then the parent will be wearing a headset, and the therapist will kind of gently instruct the parent on how to interact with their child. And this is very effective too. The book doesn't talk about this, but I think it's important to note because it's a little bit newer, but it has a lot of efficacy behind it. And you might see it out in the world once you become therapists, and you might want to be certified in it if you have plans to work with children. So the book talks quite a bit about spanking in this chapter. As a power assertion technique, it's, again, effective for short term, but if you spank once a week, it's related to higher incidence of mental disorders based on the numerous academic studies that have looked at spanking, and doesn't do much about self-regulation or morality. And severity of punishment tends to escalate over time. So if you start with your hand, you might then resort to a belt or a switch or a paddle. And it tends to just get worse over time, and sometimes more frequent over time. And so the American Academy of Pediatrics strongly advises against any kind of corporal punishment. And most experts advise parent education, emotion regulation, alternative strategies to spanking. I'm not saying that if you spank your child that you're a bad parent, or if you ever spanked that you're a bad person. It's just the overwhelming amount of evidence says it's not as effective as other methods. And the growth of a healthy self-esteem depends on an environment that provides love and limits appropriate to the developmental level. And that is chapter 5. If you have any questions, please let me or Dr. Doan know. Thank you.